What's your relationship right now with, like, conventional medicine and doctors in general? I mean, St.
Oh,
John's
yeah.
obviously isn't, at the top of
It's
your list
not
to
the
go
one.
to, right?
No, it is not the one. It is a tricky one for me
Yeah.
because, and again, like having this, I will say after my endometriosis surgery, which was November 30th, I ended up right before finding out that my SIBO was in fact back. I was having bloating again.
Mm,
And definitely I have moments when I have flare ups, when I don't feel well, that a few different things happen. I panic and I'm
mhm.
like, oh my God, it's back. And is it Lyme? Is it SIBO? Is it my hormones? Like I really can feel myself like start to spin, that like tornado comes back of like, what is this? How do I solve this? What doctor do I go see now? And then I have to like take many breaths and remind myself to breathe and that I will sort this out. And, it's never overnight. That's for sure. And then, so I did, after my surgery, end up doing, 2 weeks of Xifaxan, which is an antibiotic specifically for SIBO. And I was really hesitant about doing it, but my SIBO was pretty bad that I was like, okay, I'm going to, I did the surgery. I'm going to do this round of Xifaxan and I will feel better. Like it will be the answer. And currently it hasn't been the answer. Um, and I get a little upset sometimes because, right, like I do eat a paleo diet. So no
Yeah.
sugar, no dairy, no grains. And because I feel my best on it, because I keep inflammation at bay, I have lots of turmeric and ginger.
Mhm.
I focus on my sleep. I do my meditation. I have all my biohacking things I do. And I really feel like I live this lifestyle. But sometimes when I have these moments of not feeling well, I get in this weird like shame spiral
Yeah.
or like feel
Yeah.
like, oh, I'm a fraud. Like, how
Yeah.
am I not healthy when I live this way? And weirdly enough, I had a woman send me a nasty, but it wasn't a nice comment today on my Instagram about my smoothie and how it looked disgusting and how no one should eat like that. And I'm like, and I just like, our health is hard enough. And until you've
Yeah.
walked in someone else's shoes, especially someone with chronic illness, like don't judge. And
Absolutely.
and yes, like I am meticulous with the way that I live my life. I mean, sure, I am also human. And if I'm somewhere and there's a piece of cake that looks delicious, yeah, I might have it
Yeah.
occasionally. But like I I really live this way because I do feel my best. And when I have those moments where I'm like, oh my God, how is this happening again? Like, thanks to my therapist, that I love, I really have to like come back to that like self-love and compassion because I can be hard on myself and be like, how is this happening again? Why am I not feeling this way? Like, how can I be helping other people feel better? And I'm not even feeling good myself. And I have to remind myself that I'm human
Yeah.
and that I do have a chronic illness and, you know, living the way, and I think this really happened with endo too, as when I got the diagnosis, I definitely cried. And I remember my fertility doctor was like, oh my God, like what's wrong? And I wasn't crying again because I was sad. It was just like the relief of,
Mhm.
I know what it is now and I'm not
Mhm.
crazy and it's not in my head. And, we can kind of have a new plan to figure this out. But I really also thought to myself, like, wow, if I didn't eat an anti-inflammatory diet and I didn't focus on my health and move my body and
Yeah.
meditate, what would my endo have been like then? Right. So, like, even though I had it and even though I had to go through surgery and I lived this healthy lifestyle, like, what would my health have been like if I didn't do this? So instead of beating myself up for like, why is this happening again? I mean, granted, that kicks in at first and then I have to pull back and remind myself like, no, I am taking care of myself and I'm feeling the best that I can in this life, and living the way that I live has reduced these symptoms because who knows, maybe I would have had surgery a long time ago, or maybe I would have had more cysts burst
Mhm.
or, ended up in the emergency room or had worse complications from that ectopic pregnancy. And so I think I just have to remind myself that coming back to those daily practices is what keeps me feeling my best and is going to give me, the longevity with my health of like feeling the best I can through this healing process.
Yeah, I'm really happy we're having this kind of brutally honest take on this because I do feel I see this too, even in myself. And anyone that works in health medicine is just expected to be like purely healthy all the time, right?
Right.
And I sometimes feel that shame also. Like I told you, I'm currently living at a medical center, like, one of the world renowned, we're seeing like patients from around the world. And I sometimes like just feel like shit. I just get
Yeah.
sick sometimes myself. I stress out. I'm not eating, and people just expect like, dude, you live in how could you get sick? It must mean it's
Right.
not working. Like your
Right.
approach is like wrong or so. It's like,
Totally.
oh no. And now I don't feel like telling anyone ever anything about this, but you want to be honest that
Right.
everyone deals with stuff, right? We all do. The healthiest
Yeah.
people I've seen in the world, the gurus in spirituality have depressive thoughts, have
Totally.
issues, and we gotta be kind with ourselves, right? And we gotta
Mm-hmm.
be able to show ourselves that because that is part of the healing process. I do think what we go through is always a lesson, whether it's disease, whether it's the
Great.
thoughts we go through. Obviously, after you go through a disease, you have, like we said, that PTSD, that cellular memory of like,
Yeah.
that was hard. I don't want to go through that again. I'm scared
Yeah.
shitless because I'm starting to feel again, even a little bit of what
Yeah.
that was like. And suddenly I'm panicking. And
Yeah.
suddenly I'm like, "What the hell? I can't believe this is happening again." But I
Yeah.
do think those are also lessons along the journey to kind of to let go, to suddenly take that deep breath, as you said, and
Yeah.
take a step back and take notice. What's going on here? Is this truly like that? Or is this another lesson teaching me to evolve and become better and healthier and happier and everything? So, when you have someone like yourself that is such an expert and a pivotal person within this space, being able to freely talk about and be like, it's not easy, not always healthy every day, like have my
Yeah.
moments too, dealing with stuff. That is the honest take of what health is, though. It's still making
Yeah.
those choices. And like you said, imagine you hadn't done some of the things you were doing or a lot. And that's,
Right.
most of the population. So when
Yeah.
I speak to just people that don't even believe in a lot of the things that we do and, "Oh, detox is BS, eating that way, who cares?" And I
Right.
hear what they're going through, it's like, "Man, that sounds like a tough life." I mean,
Yeah.
that could have been much worse if you
Yeah.
didn't go through those things.